to talk to you tonight about the things I've seen you do. I've come to set the records. I've come to shine the light on. Let me introduce myself. I am the cold hard truth.
Okay, good evening, folks, and welcome to another segment of the Cold Hard Truth. This is the morning edition. So listen, we decided to do a morning segment today because I know that so many of you have questions about what's transpiring all day yesterday and into the weekend. I was getting a lot of messages and, people are obviously extremely concerned. And, people just kind of want to know what's going on. And people have said to me, listen, your voice is extremely, relevant and useful to us in terms of what's happening in the community. And we would like for you to be able to just keep us abreast of what's happening. And not everyone understands, precisely what's happening. I'm just going to start the Instagram feed here as well, because we try wherever possible to keep the Instagram people in the loop. Let me just do also a quick audio check. Everyone understands. Yeah, so audio sounds good on my end, which means that you guys should be hearing it without an issue as well. So, so I decided to do a morning edition today. Normally my mornings are like super busy trying to get out the door. I'm just going to start Instagram. But again, I thought it was important for us to kind of just get a jump start on everyone understanding exactly what is transpiring. So good morning to all of you. Good morning, Jade. Thank you so much for tuning in. It's a little bright and earlier than we normally would have our program. Rubenice Harris, Miss Ruby, thank you so much for tuning in as well. We've got a few people tuning in on Instagram. Looks like Instagram might be the early risers today. So again, if you're just tuning in, we're trying to break down kind of what transpired yesterday. And there's been a lot that's been going on, and we're expecting to have now daily press conferences, which I think is a fantastic idea, to just kind of keep the people abreast of where the government is, what they're discussing, and what we can expect in terms of additional developments and kind of where we're at. So let's just recap. And then I want to go through some of the questions that I know a lot of you have been having, and also, kind of what's been going on recently around the world in terms of the coronavirus, and hopefully, people's efforts to kind of slow this down will start to take effect here shortly. So governments around the world have been doing a lot. And of course, our government is certainly no exception to that. And we're going to, have a look at what's trending in terms of the coronavirus news today as well. So again, thank you guys so much for getting up early with us this morning. So as you guys know, over the weekend on Saturday, the first thing that was very, very shocking that happened. Good morning. I think it's Matthew. Thank you so much for tuning in. We found out that the gentleman who's 68 years old who had the coronavirus passed away. He died at Health City. Well, we actually don't know. I don't think they ever said that he was still at Health City, because we had heard some rumors that, was he still here? Some questions. Was he still here? Was the air ambulance off? I'm assuming that he was still here, or Health City may have said that. Don't really know, to be honest. But he passed away. And, the official cause of death is complications from the coronavirus. I think he had, the pneumonia that's associated with this and so on. They gave a very medical sort of response to why he passed away. You know what I found so incredibly interesting? Good morning, Nicola. Good morning, Miss Lily. There were a number of people, mostly on Instagram, and I keep saying this because, Instagram is a very different crowd traditionally than Facebook, and even a lot of the responses and stuff that we get on Instagram and the comments tend to be very different than what we get on Facebook. But it seems like a few people, and again, you have to keep these things in perspective. Like I always say to people, listen, if we have almost 12,000 followers on Instagram, sorry, and we literally have 5 people say something, that doesn't mean that those 5 people are the majority opinion, because there are another 11,000 and odd who haven't said that and who haven't liked that particular comment. So I think it's extremely important to keep things in perspective. But when I see people making comments on Instagram or even on Facebook, sometimes it is important to address it, because it could be more people are also thinking that way, but they just don't want to say. So good morning again, folks. So, a number of people are like, well, why do we need to know his cause of death? And this is invasion of privacy and da 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 da. And I'm thinking, invasion of privacy? That's such an odd thing to say. Number one, this is a public health concern, first of all. So, of course, we're going to know why he died. But it also got me to thinking about how we tend to still live very much in a bubble here in the Cayman Islands. And we have a concept about certain things like privacy, when nowhere else in the world do they think of this as a privacy issue. So even if you, are out on the road and you get ran over by a car or you got shot by someone, the police and eventually the coroner's inquest is going to find a reason for your death. And that information is all a matter of public information. So police will say, this person was shot, this person was robbed even. I mean, that's public information. So I find it a little bit interesting when people sort of have this idea in their head that there's some entitlement to privacy when someone has died, especially, it doesn't exist at all, but especially in a situation like this, where this is a public health concern. We all are concerned about the coronavirus. Now, they're not going to give a name. That's a different thing. So they're not going to say who this gentleman is. The public officials won't say that, just like they're not going to normally say, that it was, although for murder and statistics like that, eventually they do tend to name the victim as well. They name accident victims, but probably in this case, they will not name this individual. Having said that, though, naming what he died from, in my opinion, is not a big deal. We obviously all knew that we had an Italian gentleman here who was sick, and it almost seemed quite logical that if he passed away, they would have said why he passed away. So it was a little bit bizarre, I thought, that people are like, well, why would the media even ask that question? That's an invasion of privacy. And I'm thinking, is it really? Okay, a bit strange. I certainly didn't see it that way. And I also think about the fact that, when you get a coroner's inquest, which is a court process, by the way, you tend to, I don't know if you guys follow those or not, so I've got a little tissue here. Morning sinuses. But if you've ever followed an inquest before, you will know for sure that they provide all sorts of information. They interview the medical experts to try to inquire as to why someone passed away. And that information actually is a matter of public record. Like, again, it's in court. So you can go to court and you can sit down and you can listen, just like any other trial or any other case, you can listen to a medical inquest into why someone died. And, that's a process that a lot of the family members will want to be there for, especially if it had anything to do with any sort of medical related issues. Just one second to my Instagram people. My apologies. I need to just turn on this system here. So I think it is important for us to hopefully recognize more and more when these things are happening, and for us to maybe not get too emotive about the situation. So, sometimes we do respond more with our emotions than really trying to understand the process. So that's the first thing that I really thought it was important to perhaps address and clear up this morning. So he passed away on Saturday. I want to extend my condolences, obviously, to his wife. I cannot imagine the ordeal that she has been through in the situation that they are currently going through. And you know what, to me, is very, very interesting is the fact that we get a lot of tourists in our jurisdiction who really love to travel at an older age. And I don't know if you guys have recognized this or not, but it's happening more and more. So I find that more and more we're getting people who are requiring medical assistance, who are dying, who are, coming here and drowning and having heart attacks in our waters and that sort of thing. And I had someone say to me over the weekend, why do old people travel? And I'm thinking, well, on the one hand, I can understand their mindset is probably why not? Travel, it's like your last hooray, you're in retirement, maybe you have additional funds. But then there are other times when you do see people who are really, really high risk, barely can walk, they're on oxygen, being pushed by somebody else. And you think, wow, is this an ideal candidate to be taking a cruise ship? So I don't really know. I think that I kind of feel a little bit torn by that way of thinking. Part of me is yes, why are these elderly people who have health concerns traveling to other jurisdictions and putting those jurisdictions, sometimes at risk, such as this, where it's a public health concern, but also just, weighing down on our resources because now we have to deal with, all that's associated with their demise. But at the same time, another part of me is hey, you live once, maybe you just travel because at that age you want to see the world and you want to experience some of what life has to offer before you die. But we have had, I think, a higher than normal rate of persons coming here, especially the elderly, and passing away. So I was just thinking about his wife, and I, can't imagine the situation that she's in, being away from home and then having to go through all of this. And she's also in quarantine herself. So, of course, that's a very, very difficult situation to then be told that your husband of probably a number of years has passed away under these circumstances. So definitely, condolences to her and the rest of his family. Now, Italy, interestingly enough, has been really taxed in terms of, what is happening in that jurisdiction and what's going on. Their medical system is just under extreme pressure. And, when we think of countries, I've never thought much about Italy, to be honest. I've got Italian acquaintances and friends, and, I've never heard that they were a super poor country and everybody's got poverty and issues and whatever. But this really has highlighted for me how sometimes we don't really know a whole lot about what's going on around the world. And so there are things that we assume we know about countries oh yeah, this is a first world country and they're doing well and blah, blah, blah. And then an outbreak like this happens, and you actually recognize very, very quickly that Italy obviously has some underlying issues in terms of their infrastructure when it comes to handling, just medical emergencies and situations, because they have not been able to handle this well at all. And it's taxed their medical system to the point where they have basically instructed physicians that anyone who is elderly who comes down with coronavirus, essentially you're not to treat them. You're going to allow them to either, if their body can fight it off, or they're just going to die because there's not enough resources to go around. So they're having to prioritize who gets the resources in terms of just regular, treatments. Because please keep in mind, there's no vaccine for this. There's no, there is no cure, obviously, for any of the flus, but they do what's called like secondary treatments. So, they're going to offer things like, if you're having respiratory issues, putting you in a ventilator. And that's why it's really, really, really important to have ventilators available, because that's one of the care options that's one of the treatment options that is available for people who are suffering from coronavirus symptoms. So again, it's a very interesting situation. A lot of countries are actually realizing that they're not handling things well at all. Like, there's a whole article about what's going on with the testing in the US and kind of why their response has not been the best in the world. There has been an article in the New Yorker that addresses this, and it said basically that kits were sent in cardboard boxes. Inside each box was 4 vials, packed in stiff gray, I'm just reading some of this, foam. And then it goes on to say how several labs reported that there were problems with the testing kit. So they have actually found that, some people have been getting fake testing kits that are giving false information. So that was one concern. And there was others that was only like 60% accurate. So faulty tests, I think, is a big issue. And that was one of the things that this article in the New Yorker talked about in terms of the CDC having these faulty kits. So you think for a minute, wow, if the US isn't able to get it right, and they're, again, we think of them as kind of like a first world country, the leaders and everything, but obviously they have their own issues as well. And yes, they have made some mistakes, and, their lessons, I think, that hopefully we can all learn from situations like this as we move forward, not just with this particular situation, but even diseases in the future. One of the things that people are failing to realize, like, everyone's like, what's going on with this coronavirus? This is ridiculous. People are overreacting. This isn't something that we really need to worry about. On the one hand, there is some truth to the fact that the coronavirus isn't yet as deadly as the common flu. But I think the biggest concern about the coronavirus is the way in which it's trending. And the other thing is, 30, 40, 50 years ago, with other outbreaks, there's one major difference is that, again, we are so much more accessible to each other in terms of travel. So in this day and age, I could literally get on a plane and be in the UK by, 8 hours later, or whatever the flight time is, depending on where you're going from, halfway around the world. So people are traveling so much more. People have greater access to different countries around the world. So the ability to spread something very, very quickly, as we can see from how this particular virus started in a city in Wuhan, and just that was the ground zero, that was the epicenter. And then it just went out from there. And then you've had some other hotspots that have been struggling to deal with this, including places like Italy. Like Italy is a European hotspot. And so, the ability to track this disease now almost in real terms, I think is something that's amazing. There's a number of different websites that are up that have tracking capability. The numbers like change by the second. Like, this is how many people have died. This is how many people have had it. This is how many people have recovered. And yes, the vast majority of people will be recovering from this. There's also a large number of persons who will have this disease or this virus and not even know that they have it, because they will show absolutely no symptoms at all. They're not going to get sick. They're not going to have respiratory issues. So their bodies are able to fight it off. However, those individuals are able to transmit the disease just like someone who's actually sick. And I think that that is really, really, really important to recognize. So if you're in a grocery store and someone coughs, I mean, don't beat them up, don't knock them out. It could be something else, but they're just as much a threat as the other person next to you who doesn't cough, because that other person next to you who doesn't cough may very well have the virus as well. So one person on Instagram is saying, what happened to the people isolated from Health City? So we haven't heard a whole lot about those individuals, but when they say they're in isolation, we are assuming that that means that they are being quarantined at probably home. So this is probably home isolation. I doubt that Health City has the facility to quarantine some 30 people. And we do know that they have sent off a number of test kits, so that people can get tested from that facility that probably are showing symptoms. And we're going to go through in just a minute here some of what they like. How do they decide if someone gets tested? Because remember, there was that one number 6 case recently that didn't get tested. And a lot of us were like, why wouldn't you test this person if they're a suspected case? And basically, the chief medical officer said yesterday that once they reviewed the symptoms of that particular patient, number 6, they then determined that maybe this really wasn't a case of concern for coronavirus. So not everyone that has flu-like symptoms can just run now to the HNC and say, hey, I want to get tested. There's certain very, very specific things that they're going to be looking for, and we can talk about some of those in just a minute. And are there kids also there? So we had invited Mr. Shamari Scott onto this program so that we could get a bit more information on what was happening at Health City and what was transpiring. We know that he's obviously been very busy. We've not yet received a response from him. We would like to continue to extend that invitation. So I think that those types of questions are really ideal for a representative from Health City to answer, because they're going to know. They'll be able to talk about, were there any other patients at risk? Obviously, if their parents are at risk at a facility like that and then they go home, I would think that the whole family could potentially be at risk for catching this virus, because that's how contamination works. And that's how cross-contamination works. There was a post yesterday on Facebook that was actually trending and going viral about a lady who was talking about her experiences at the airport and how it's very, very obvious that airport workers, everybody from baggage handlers to customs agents and immigration and, the whole 9 yards, that they don't seem to have an understanding of how cross-contamination works. And she gave some details in her post of why that is. And she's actually hopefully going to be joining us on the program. I don't know if she'll be available tonight or another day, but she's going to come on and talk about what she observed and what she saw. Because one of the best ways to stop this disease is to actually practice what we now call social distancing. And there's an entire article on University of California, San Francisco, talking about why experts are urging social distancing to combat the coronavirus. And so what social distancing is, just to make sure that we all understand it, in simple layman's terms, it's like just staying away from people. And there's a recommended, I think it's either 3 to 6 feet that it said 1.4 to 6.5 meters, which is basically an average of 3.3 feet from other people. And, that is very, very, that's like one of the top things that they are recommending about trying to flatten the curve, as they say, in relation to the spread of this disease. So this is now, trying to reduce it, trying to mitigate it. It's already out there. Most countries now have at least a confirmed case. Jamaica's got, I think, upwards of 10 or 15 cases now. Honduras, after they found 6, they closed and shut down their borders. Cayman, as of yesterday, has now shut down their borders. We're going to talk about that here in a minute as well. So social distancing, that's a phrase that we've heard. Many of us may not have even heard it before the coronavirus, but now we're hearing it time and time again. And again, that's just keeping a distance between you and other people when you're out and about and when you're out in public. So as you guys know, one of the things here that was implemented last week when the government, basically said on Thursday, we've got our first confirmed case. This is what's happening. We're going to start implementing some measures. One of the first things that they said is no gatherings, no public gatherings of 50 people or more. Now, obviously, they can only control what happens in public spaces. But if you're having a house party and you're inviting 50 people or a bunch of people over, you're doing the same thing, and I don't know if that technically is considered a public gathering, but I would caution you because you're doing the exact same thing that they're recommending not to do, and you're potentially exposing other people. One of the excellent points that the chief medical officer made yesterday is he said, listen, when we talk about, it's not so much about, because a lot of people are focusing on the 50 people. So, like the health minister said, oh, he went somewhere and they were like, oh, you're number 51, so you can't come in right now. That's not the point. The point is, even if you took 25 people and you put them in a confined area where they cannot exercise that 3.5 feet to even 6 feet distance between each other, you have created a problem. So in the US, I think they're now saying no gatherings of like 15 or more or something like that. Like their number is even more stringent because, again, it's not really so much the number of people that you're around. It's the ability for you to not have that space between you and the next person that's extremely important. And so that's what it boils down to. So they're trying to give you these numbers as guidelines because they figure, okay, if you're in an average restaurant and the restaurant can hold maybe 200-300 people, if you say no more than 50, that gives you enough space to spread out. But if the restaurant staff do not understand the principle behind this no more than 50, say, for example, they decide to close off a certain segment of the restaurant to try to save electricity and running up and down and whatever in that segment, and they have every single 48 persons huddled into one smaller portion of the restaurant or area, that defeats the purpose. Like, that doesn't make any sense. And so I have someone just sending a message I'm going to look at here in a minute about the Honduras flight. So yes, I mean, that's where you need to connect it in your brain. Like, that's where it's important. So this article has basically said that social distancing, they have recognized as one of the major ways in which you're going to contain the coronavirus. So it says here that many factors contribute to the so-called reproductive number of the new coronavirus, which describes roughly how many people are infected individually will go on to infect other people. So currently the estimates of reproductive numbers range from 1.5 to 6.5. The higher the reproductive number, the faster it will spread. Factors that affect the reproductive number include how inherently contagious the virus is. So that's one of the things. Another one is how susceptible people are to infection, and then the number of contacts between people and the duration of those contacts. So those are kind of like the four primary things that we need to consider, right? And how quickly this is going to continue to spread, or if we can flatten the spread a little bit. So the virus is obviously contagious. So that's the first thing that they're looking at. It is a very contagious virus. It's like any other flu up to a certain point. This one is spread by droplets. So we're going to talk about that in just a minute here. How susceptible people are to infection. Well, you know that you can control that up to a certain point. So you can wash your hands, the number of contacts between people and how long you're in contact with people. So if you're around someone who's carrying this virus and you just see them for a split second and you're gone, the chances of you being able to catch it from them is obviously far less than if you stand up and have a 10-minute conversation with that person and you're touching them and, they're in your face kind of thing. So these are the factors that like the medical experts look at when they talk about, how quickly a disease like this is going to spread. So we can't do anything about the first two phases of this or the first two factors. So, more people are going to be inherently more likely to catch this than others. We know, for example, that anyone who's a compromised system, they are extremely vulnerable. So if you are a diabetic patient and say, for example, you're in dialysis, your immune system is compromised. If you have any number of diseases or people who have lung diseases or people who have skin diseases, I was speaking to someone the other day who has something called scleroderma, and that is similar to, it's in the same category of like immune issues like lupus and MS. So, the body almost attacks itself and they have to take suppressant medication to kind of suppress their own body doing certain things. And so that in itself has a weakening process on their ability to fight off other infections and other diseases. So those persons are definitely in a higher risk category. So if you have lupus, if you have MS, all of those things are certainly something that will compromise your immune system and make you more likely to get something like the coronavirus or any illness really that you have to be extremely careful about. So the first two factors we can't do a whole lot about. The last two, which is the number of contacts between people and the duration of contacts, that's really where social distancing comes into play and where they're trying to educate people about precisely what that means. And, the fact that they really want people to exercise good common sense where that applies. So, I see some comments are coming in on Facebook, so just give me a few and I'm going to get to some of those here in just a second. So, so again, they said social distancing can effectively extend to environmental precautions such as disinfecting often touched surfaces. So that's important because obviously, the things that we've talked about before that you touch a lot, they will certainly pass on the virus. Social distancing mean banning large gatherings. So concerts around the world have been canceled. Sporting events around the world have been canceled. Like every single, I think, football match in the world has either been canceled or they're playing to empty fields. So it's just the team members and they are, playing with no one else in the stadium. And I've seen a few of those games. The other thing that is interesting is a lot of, actors and actresses and we saw an NBA player the other day who actually got it. So they're just like the rest of us. They're out and about and they're going to get it. They're going to get sick just like everyone else. So there is that whole, they're players, yes, but if they get it, if they come down with symptoms, they need to then protect the other team members as well. So there's all of that. So a lot of social activities have been canceled and being discouraged entirely. So here we see on a local level, for example, the government has said shut down schools, just close schools for about 6 weeks. No, if your church has, and again, let's not focus so much on the 50, because you might have a small church that only has 10 people. But if you're in a small room with those 10 people and you can't exercise that acceptable social distance, then you are creating, a situation and you should have church remotely. We all have live streaming options. Churches have been able to live stream for a long time now. A lot of them did that over the weekend. I think that's a fantastic idea. I don't think that God is going to be concerned how you're meeting, whether you're using technology to have that meeting and you're doing like a group chat or you're praying together in the phone or whatever, versus, being in each other's presence. There are a few people who felt very kind of like insulted that Alden, when the question was asked of him last week by Rejma from the Compass about, okay, so on Sunday, should I go to church? And he said no. That limit of public gatherings includes churches. It includes funerals. And we're going to talk about, because I know Churchill sent us something late last night that we're going to put up today as well, basically indicating what their policy changes are, because it is hard. I mean, I know that young man, I think his name is Mikey. He passed away. And so his funeral, would have been this weekend. And so it's hard for people who are used to going to like big funerals. And, Caymanians, we feel like the bigger the funeral is, the bigger the gathering, the more your life somehow had value to it. So we want to see hundreds and hundreds of people come out to funerals. But right now, that cannot be. And I'm sure that might be a sad situation for a lot of persons, but, that is what it is. So encourage people to follow the social distancing rules and be sensible about it. California has ordered, they've set up orders in places like shelters. Listen, even in our prisons, no one has publicly said this, but the government, to the best of my knowledge, the governor has actually signed a proclamation of some sort to allow low risk prisoners who I think got like a certain amount of time left to actually come out earlier than they were scheduled to come out. Because even the prison that has hundreds and hundreds of people in a very confined area, because again, you've got 2 men to cell, and that cell isn't particularly large, that is also creating a safety risk. And, they have now stopped visitors going into the prison. The hospital has stopped visitors. The Pines over the weekend has stopped visitors. And of course, now we're actually extending that out and locking down our borders. So the coronavirus guidelines for America says everyone should avoid social gatherings of more than 10 people. So we're not even being that stringent when you compare it to other people like America. Avoid eating or drinking at bars, restaurants, and food courts. So a lot of people are now just doing takeout. And I think that they have actually forced closed a lot of those restaurants and stuff as well. And I mean, the economic impact of this, listen, I cannot think of a single event that has had probably this level of economic impact. Because even 9/11, like those of us who remember 9/11, who lived through that, Hurricane Ivan was isolated to just the Cayman Islands. 9/11 was a little bit broader. So there was New York. It shut down the travel space for quite some time. And there were a lot of major events and stuff that were canceled. So that was a much bigger event in terms of the impact around the world, right? Like, boom, 9/11 happened. Europe was impacted. The US was impacted. Obviously, the Middle East was impacted. The Caribbean was impacted to a smaller extent as well. But this coronavirus, when you think about what this is doing, shutting down entire countries. So no travel at all, people shutting down their borders. Honduras, the US has shut down their borders, now including the UK as well. This is humongous. Cayman having to shut down and isolate ourselves from the rest of the world. So the fallout from this coronavirus is amazing in terms of the steps that countries are having to take to try to contain this. And at the end of the day, what else can you do? There are a lot of people who believe that this was somehow orchestrated and this was, a man-made virus. We don't know that for sure. I think that if it is, we will eventually get confirmation that this has happened. Because in this day and age, governments around the world, yes, they try to hide a lot of stuff. They try to hide information. Sometimes they try to keep us in the dark. But people have the technological resources to get information, to dig. And eventually, if this is what went down, we will know and we will all find out. Is this really something that came out of a meat market in Wuhan because they have some very unusual eating habits, eating bats and dogs and all kind of foolishness that, allows transmission of certain types of diseases? Or was this something that was contained in the infectious disease lab in Wuhan that accidentally got out? And the Chinese are trying to keep it under wraps. They won't be able to keep it under wraps forever. And eventually we will find out more and more information about how this whole thing started. So California and the Bay Area, they're ordered even shelters to shut down. So the poor homeless people, now have a bit of an issue. Everybody's being told to stay home. If you're 60 or over, you're at the highest risk of dying from this virus. So it's suggested that you try to self-isolate as much as possible if you're in that older population. So according to some experts, more than 120 million Americans eventually will be infected with COVID-19. It's already starting to mutate. So apparently there's like a COVID-19 version 2 kind of a situation. Some people say those estimates might be a little bit high, but that's a lot of people, even if you cut that in half, even if you say 60 million Americans. So they're saying that if 2 million people were in critical condition, that would easily surpass the 98,000 intensive care unit beds. That's all they have in the US, 98,000 intensive care unit beds, and 62,000 full feature ventilators available in the US. So apparently, let me just talk about the ventilators, because I know this came up yesterday in the press conference and someone was asking me about it. These ventilators are considered extremely important for the control and management of this particular type of coronavirus, because it helps with like the acute care that's needed. Because one of the things that you get with this particular one is this pneumonia, and the ventilation will actually help ease that and potentially even save your life. So the ventilators are really, really important. There's made mention yesterday by the chief medical officer that we have some on the way. We ordered some additional. I think it's 4 that are coming, and I think we had a few here already. Obviously, if we have a major outbreak, that's not going to be enough, but it's certainly a start. So the word catastrophic and pandemic are being used to describe what's happening, and I think that those are really important. It's true. Those are accurate words. So COVID-19, everybody's like, some people who are like, oh, you guys are fear mongering, just leave it alone. Everybody gets the flu. More people die from the flu. But here's the thing. COVID-19 is not just a bad flu. That's not what this is at all. So I do want to clarify this, and why, yes, we're not trying to send people into panic mode, because that doesn't help anyone, like we saw with the panic buying, for example. But we also need to recognize the differences between this and the regular flu, and why people are rightfully concerned. There's a reason why people are shutting their borders, for the COVID-19. So unlike the flu, there is no known treatment or vaccine for COVID-19. So that's the first thing. You can get vaccinated for the seasonal flu, influenza A, right? And B and whatever. So you can get vaccinated. Vaccination against the flu is normally offered free of charge here in the Cayman Islands from the HSA. It may not give you 100% protection, but even if you get protected against 60% of the seasonal flu strains that are out there, that's way better than having zero protection. So right now, no one has a vaccination for COVID-19. There are countries that are working on a vaccination, and we will certainly have to see, kind of how that goes. We know that Germany, there's scientists in Germany who are working on a vaccination, because apparently President Trump heard about their work and he wanted to actually hire them and bring them into the US so they could work exclusively for the Americans. And then he would have a lockdown on the vaccine, which I don't even want to tell you what I think about that. Like, that is so wrong on so many different levels and so incredibly selfish. And it speaks to someone who has lived a life of privilege, where they just think that they can I'm just going to go out there and buy a cure for this disease that's impacting the entire world, but we don't want to offer it to anybody else. We want it exclusively for us. We're going to treat all our people first, make sure it works on all of our people, and then maybe we'll quadruple the price and try to sell it to other countries that we like or that we don't like. Or, I mean, you could see the implications of someone like President Trump being able to get this exclusivity on a vaccine, right? And how he could potentially use that. Oh, well, guess what? We can't build the Mexican wall. Well, yeah, we're going to not build a wall, but we're going to make sure that you don't get this vaccine and all your people are going to die from COVID-19 anyway. Or, you know what? We're sick and tired of the Cayman Islands allowing our citizens to go there and use your banking system to circumvent paying, their taxes and whatever. So we're not going to offer you the vaccine either. I mean, there's so many implications to the president of one of the power nations in the world trying to get a hold of this vaccine exclusively for the American people. Like, there's just something off with that way of thinking, in my opinion. So back to why it's not like the regular flu. The overall fatality rate is something like 1 to 2%, which is actually 10 to 20 times higher than that of the flu. So a lot of people have been saying, oh, the seasonal flu kills more people. Well, that's true so far. So the seasonal flu, say it kills, 11,000 Americans in a year. Yes. But this virus hasn't been around a year. This virus has only been around since late December. And now we're in mid-March. And the way that it's trending statistically, it is killing a higher percentage of people, 10 to 20 times higher than that of the regular flu. So that's important. Like, you got to really be able to pick apart when people say certain things to you, do your own research and understand what it is that people are saying. So technically, yes, the flu virus, in terms of the numbers, has killed more people. But when you look at the percentage of people out of those infected or known to be infected that have died, the percentage with this particular virus is actually 10 to 20 times higher. So that is another significant reason why the COVID-19 novel virus is scary and why people are rightfully concerned. You may also, we as human beings may also be more susceptible to the novel coronavirus because we haven't encountered it before, this particular one. So we don't have an immunity. You know what I'm saying? Other strains of the flu, they're already in circulation and have been in circulation forever, for generations. Your body does, despite the fact that you may still get it on occasion, your body does have an immunity built up to a lot of those things. A new virus, there's no immunity. And someone kind of gave this analogy. It's like we're all running around naked, right? And that's what, genetically is happening here from just a medical perspective. So one of the interesting things, though, that is very, very interesting is apparently there's, just trending again, looking at the numbers and how this is happening. It seems that younger people, 10 and under in particular, seem to have almost a genetic innate immunity. And that's why a lot of the younger people, kids basically, haven't been getting it. And if they do get it, they're getting a more mild case and not the severe cases. And I don't think that they've had very many children actually dying from this at all. So there's something in there. Somebody speculated the other day, well, maybe it has something to do with like the vaccinations that kids have received, because again, they're vaccinated at younger ages. I don't really know what the immunity is and how it comes about. But at the end of the day, they've seen this, that the young and healthy people, the younger you are, it seems like you have sort of some protections already built in. And again, they're saying, that those people are the ones who are critical to this whole concept of social distancing and making sure that, you try to just manage that and to stay away from anyone who is and the middle age to older kind of generation. So that was, I think, hopefully some useful information. Let's look at some of your questions. I want to bring it back locally now and talk about some of the stuff that's happening here in Cayman. So Campbell says, my contract for my apartment ends on the 31st of this month, so I don't have a place as yet. As a landlord said, they had plans for the apartment. Okay. I'm not sure if that has to do with coronavirus specifically. But one of the major concerns, and this is just overall, we have no rent control in this country, obviously. We have no landlord control. We barely have a tenancy law that, I mean, it doesn't have any teeth in it. So you are at the mercy of your landlords, people. And this is one of the reasons why, if I don't ever have to rent from someone, I'm like, try not to. Because landlords can be fickle. They can increase your rent with little to no notice. There's nothing that you can do. Like, you can be paying $1,000 today for a little hole in the wall apartment, and your landlord comes over tomorrow and they're like, oh, well, I want to increase the rent to $2,000, to $2,500. And there's nothing that you can do. You know, all you can do is look at your contract. Chances are they have written a contract that is favorable to them, and you got to find somewhere else to go. And that's, one of the failings of our governments that we see rear its head, definitely in situations like this, but all the time. You can't have a landlord tenancy situation which impacts, most people in this country. At least half of the population here, if not more, are in the rental market. So 60% of us are probably renting, and you have no protections at all in legislation. So landlords are able to run amok and to do whatever they want, charge you whatever they want, sometimes invade your privacy, come into your apartment. I mean, it's just like run amok, and you have absolutely no protections. Government needs to look at this situation. Once this coronavirus has died down, this has to be one of those things that hopefully will make the top of their list. Yes, we're not trying to put, we do understand it's a contractual relationship, and we're not trying to overburden landlords either, but there has to be a balance. There has to be a fairness to the process. And currently there is no fairness. Tenants are at the mercy of landlords. And that creates a lot of very interesting situations. So even with this, coronavirus and what's happening right now, everybody's like, okay, the banks have said, and the premier said this yesterday, that, they are willing to work with people. So if you have a mortgage and because of this, you may be unemployed, you need to go to contact your mortgage holder, contact your bank, speak with them, because they will be willing to work with you. If you explain your personal situation, they may allow you to, normally they're not going to allow you to just get a complete pass, but they may say, just pay the interest this month or whatever, if you can. Some people are not even going to be able to pay that, to be honest. But, so you have banks that are willing to work with you, potentially, depending on who your bank is, but reach out to them. But then you have people who are renting, and although their banks might be willing to work with them, the landlords, those same landlords, because a lot of them have mortgages and stuff, sometimes on their rental property or their primary homes, they're going to then not be willing to work with tenants. And I really want to encourage people, if you are a landlord, to try to have a heart in a situation like this. Yes, we know that you have your bills. Yes, we understand that everyone has to make a living. But if you go to your bank and you explain your situation to them and they're willing to take a lesser payment or whatever, please, if you get the benefit of that, pass that on to your tenants. Don't just take advantage of that and nobody else gets the benefit, if you know what I mean. Like, don't be greedy. It's like people who are going to the store and buying 6 months worth of medicine and supplies and allowing those medicine and supplies to run out so that nobody else can get. It's like, come on, folks. We need to understand that we don't live in this world alone. If everybody else in the world died but you, what good is all that medication going to do you? You're going to be here by yourself, surviving how? You're not going to have people to help you to do anything. You're not going to have anyone, any service people, any family members. So it's like, think about that. Like, if you're only thinking about yourself, think about what happened if you were the only person left in this world. And does that even make any logical sense? So help other people. Yes, you got to look out for yourself, but also look out for other people as well. The grocery stores have now, and I saw Foster's issued something last night. They now have an hour in the morning where they're going to allow anyone who's elderly, pregnant, or disabled, that's going to be their time. And they're asking people to respect that hour for those individuals. So if you're not pregnant, if you're not an elderly person, if you're not a disabled person, allow that time to be utilized for those individuals. And I think it's a fantastic idea. Kirk Supermarket was the first that we noticed had a 60 plus line, 60-year-olds only in that particular line. Give those people an opportunity to get supplies and to go shopping. And, and again, because they are, I think the important thing about how Foster's is doing it is they're saying, listen, this hour is for them. Don't expose them, because again, they're the highest at risk category here. Do not expose them to this virus by you going out and shopping at the exact same time that they are. Stay home. Let them have their hour, and then you go at, whatever time later on in the day. So just think about other people. Deborah says, good morning, Sandra. Nice patriotic outfit this morning. Keep up the good work. Thank you so much. I have a few of these shirts. As you guys know, there's a local Cayman who has designed these. His company is called Awa. And I encourage you to purchase. He's going to have other products and stuff coming out, backpacks and other things. He has this, and then he has the one, like the tee with the no sleeves, basically. And I've got two of these. I've got one of the other one, and my daughter has one as well. My husband's got one. So I really believe in supporting local, artists and creative people as much as we can. So Power wants to know if there's any new updates. We're going to go into a little bit more detail here. Atlas, fun fact, if you chew mint gum and drink warm water, the water will feel cold going down. You're welcome. Okay. So Matthew says, so true. Have you stay away from people? Was concerned about how many people have the coronavirus in Grand Cayman. Only hear of the one so far. Okay, so let me address that, Matthew. And I'm going to be very, very honest with you guys. This show is obviously called The Cold Hard Truth. The chances of only one person in Cayman having the coronavirus is little to none. It's almost statistically an impossibility. So I want you guys to hear me out. We have one confirmed case. We've sent off 5 others. 4 of those came back negative. The 6th one, we never decided to send off because it didn't meet the criteria for sending it off. And 1 person had it, and that 1 person has died. There are people who have the coronavirus who will show absolutely no symptoms at all. The Cayman Islands have a population of some 65,000 persons, but we have, in the time since this coronavirus has started, literally hundreds of thousands of people have disembarked on us from cruise ships, which are very, very high risk, airplanes, which are high risk, and all of this commingling, service industry workers, hotel workers, hospitals. Chances are there are other people here who have it. We may not know of these confirmed cases yet, but statistically speaking, it is very likely that we have additional cases that we just had not discovered. So it could be, as I said earlier, a situation where those persons simply haven't had a need to be tested. So maybe they're asymptomatic. They're not showing any symptoms. Or maybe they're showing symptoms, but the symptoms are not that bad, so they think it's just influenza A. Here's the other kicker. I've been told by a lab here in the Cayman Islands, a lab director, that you can have influenza A and you can also have coronavirus. So what if they went to the doctor, got tested for influenza A, found out they had influenza A, and go, oh, well, it's just influenza A. But they also have the coronavirus, but they haven't been tested for the coronavirus. Now, listen, as of today, local testing is available. And I want to talk about precisely what this means, because this is actually quite important. So the HSA now has the equipment, and they said that they're the first country in the Caribbean to have this equipment. I don't know if they meant the Caribbean or the Commonwealth. I'm trying to remember. I think he might have said the Commonwealth because, to the best of my ability, Jamaica actually has the ability to test as well. So the HSA can now test. I'm just trying to pull up the story so that we can talk about this. Because this was quite an important announcement that came out on Sunday. So the lab equipment that we required is finally here. We've had the test kits, like the tests to collect the test samples, but now we actually have the ability um, to test people locally. But there's certain criteria that they're going to be looking for in deciding if you're going to be tested. So the public health, they're going to be responsible for testing people who have a suspected case. And again, you have to meet these three criteria basically. Number one, flu-like symptoms with a travel history. Sorry, I'm trying to read this. To a country that has reported cases of local transmission of COVID-19 during the past 14 days. So that's the first thing. So if you've not traveled anywhere else, because again, we don't have any proof yet of local transmission. So if you've not traveled anywhere and you go to the doctor and you say, I think I have COVID-19, I want to be tested, they're going to say, hold on a second. Let us ask you a few questions. So Instagram followers, the live stream is going to end in 1 minute and 50 seconds. What I'll do is I'll restart it once it ends, because IG only allows you to stream for like an hour and then it automatically shuts you off. So I will restart it. So don't worry, just please log back in. So the first thing is, if you've not been to a country that has local transmission in the past 14 days, because there's this kind of incubation period of 14 days. I've heard it can be a little bit longer than that, but the acceptable time period that, they're kind of accepting around the world is 14 days. That's going to be the first criteria that they're looking for. So you're not likely to get it if you don't have because we've not admitted to any local transmissions yet. So they need to understand that you've got this travel history. The other thing is acute respiratory illness and has been in contact with a confirmed or probable case of COVID-19. So that's the other thing that they're looking for. If you just have like the sniffles and maybe a little bit of cough, but it's not medically acute respiratory illness, they're not going to test you. And the third thing is severe acute respiratory infection that requires hospitalization and no other etiology. So in other words, there's nothing else medically that can explain why you'd have this from a clinical perspective. So that's the other kind of key thing. So let me just restart the Instagram live. So those are the three things that they're going to be looking for. And again, they've received this PCR machine. They're going to be setting it up and testing in accordance with the standard that the World Health Organization has set, as well as the Pan American Health Organization. And we do have a team of 3 people, they said yesterday, here on the ground from the UK as part of UK Health, who are assisting us in any way possible as well. So Morna says Jamaica is only allowing 20 people at a gathering. And again, Morna, probably from Jamaica's perspective, the thing to recognize about Jamaica is obviously their population is a lot bigger. So Jamaica has, some 3 million people. So it is a lot more, it's a lot easier for people in Jamaica to quickly have a gathering of hundreds of people. And in fact, the interesting thing about Jamaica is patient, I guess we can call her, patient ground zero or whatever. She actually has potentially infected hundreds of people because she went to not just a public gathering, but she actually went to a funeral. And funerals in Jamaica can literally be, like crazy numbers. And so she decided to go to a funeral. And of course, there are literally, it's just super crazy, but they're now thinking that they could have hundreds of people infected just from her decision to go to that funeral. Super, super crazy. So please keep in mind, again, yes, Jamaica has a larger population, but you also, that means that the risk for them is greater in the sense that they can easily have a lot more persons who are, in close contact with each other and stuff like that. So again, their first confirmed case was a lady who had come back from the UK. She had that travel history. And then before she actually was diagnosed and she was tested, she was out and about, went to a funeral around people. And at funerals, everybody's hugging each other up, kissing each other, all this kind of thing. And boom, you've got an explosive situation on your hands. So Jamelia says, why haven't we heard the other results? So just to be clear, they have said of the initial 6, so 1 they decided not to send off, 4 negative, 1 was positive and he passed away. Now the persons, that 30 plus persons that were around him, supposedly only some 14 of them met the criteria that we've just talked about here, that kind of 3-prong criteria that's required to send off for testing. So there's at least 14 additional tests that they will now be testing now that they have the equipment. But, the thing is, they have 400 test kits, I think they said yesterday, and they're supposed to let the World Health Organization, I guess, who's distributing these test kits, know if they require any more. But let's be very, very clear. They are not going to be randomly just testing people, right? So they're not going to test, somebody said this earlier, they're not going to test the entire population. I mean, it doesn't make any sense to do that medically. You're going to be wasting a lot of test kits and a lot of resources. And that's just not how testing for diseases work. I know from our perspective and from a layman's perspective, we think, why not? We're not that big of a population, just test everybody. But that's not the medical protocol. So we have to follow, as a country, establish medical protocol that is set by places like the World Health Organization or PAHO, the Pan American Health Organization. Okay, so I just received a tip. We're going to talk about some of these things here in a second. Okay, so someone has sent this in, and I've heard this before. And a lot of people have actually been sending us tips here at Cayman Road about people who are businesses who are not adhering to the 50 per, the 50 limit. There's one business, for example, that actually has like 3 businesses all kind of like basically in the same building. And so they have said, oh, well, we're going to, the 50 limit gathering is going to be per business. And that's not what the government has said, right? They have said 50 persons or more in public, but it's like that logic is someone who only cares about money, and they're not being genuine about trying to protect their customers. For you to encourage people to come out, knowing what the government has said, knowing that the medical professionals have said, encourage social distancing. So it doesn't matter if you invited or you allowed 25 people in. But again, going back to that concept of how much space are you talking about? Are you able to spread people out where they can have that social distancing that is being recommended? If you've not done that, or if you're not taking those measures seriously in your restaurant, your gym, you're a business owner, then you are honestly putting people at risk. And for the sake of what? So that you can make an extra buck. So someone has just said that the gyms are a cesspool for viruses and bacteria, which is true. I mean, listen, you want to get sick, start working out and go to the gym. Tourists coming in every single day, gym members can be victims. Why are they willing to spread? This person said, would you be willing to spread that awareness? Someone else had mentioned as well about gyms. There was a gym over the weekend that was open, even though the proclamation has gone out and it's in the regulations, people, it's against the law. So you can be fined, and there is a jail sentence that goes along with that as well. So, ignoring this should be a very, very serious situation, especially if you're a business owner. And so there were parties over the weekend. There were people at social gatherings. There were still churches who defied the government regulations and met anyway. And so I want to say that if we get that information, which we have already gotten it on a number of businesses, we will be passing that on to the local authorities, aka the police, for them to handle it and to do what they need to do. So this person on Instagram says, what do you do if you know someone who's traveled and refused to turn themselves in? So that's not the only criteria that they're going to be looking at in terms of health factors. So if you know that the person has traveled and they also are having, acute respiratory issues, or they're extremely sick and they are not turning themselves in, what I would recommend is the flu. There's been a flu hotline that has been set up. They have an email address and they have a phone number. Send them an anonymous tip saying, listen, my cousin just came from Wuhan, China, and I am seriously concerned that she may have it. And she's, being a little silly thinking, no, it's not a big deal. Maybe someone could reach out to her. Here's her name and here's her contact information. Self-quarantining may be the recommended steps to take, but sometimes as human beings, we don't always recognize when we need help. And so, that's a possibility. I would say that maybe there are some people that you need to inform them. I mean, I hate to say it that way because everybody's like, oh, don't be a snitch, blah, blah, blah. But maybe you got to snitch on some people just to keep them alive and to keep the rest of us alive and well as well. Ingrid says, can government stop the flights from La Ceiba? Spoke to a nurse this morning, and she's mentioned 2 more cases, people who have been in contact with people at the airport. Okay, so Ingrid, as of Sunday, Honduras said that they had 6 confirmed cases. It's probably gone up since then. I haven't really checked recently, but they have actually closed their own borders. So it is my understanding that between now and Thursday, when we are closing off our flights, basically, that's when that's going to start. We have, I think, 1 more flight that will go into Honduras. But even as of yesterday, my sources indicated that Honduras, because they've closed off their borders, they are only allowing Honduran nationals to come in. So if you're a Caymanian and you're going to Honduras, unless you're dual national and you're staying in Honduras, don't go on the next plane because you will not be coming back. And Honduras won't even let you in unless you can prove that you're Honduran. So Honduras has already shut off their borders. And yes, they are taking that very, very seriously, because even yesterday with the flight, they were only allowing Honduran nationals in, and then out from Honduras. You can only come back in Cayman Airways if you're a Caymanian. So if you went there on vacation and you're trying to get back, it looks like you're going to be stuck in Honduras for a little while. Charlene says, for the elderly with underlying health issues or who are asked to self-quarantine, is there anyone in the medical profession visiting them at home or other resources available to them? Just curious. So Charlene, I don't know. I mean, obviously, if they have a private physician, there's that chance that, they could call in for a private physician to visit them. I don't know if the HSA has that set up, but I can certainly inquire. I mean, if their symptoms are bad, especially as elderly, they definitely need to go in. But I think that's quite a good question, and I'm going to pass that on. Just give me 1 second here. I'm actually going to pass that on to the HSA, and let's see if we can get some response from them on that. And of course, we're going to have our regularly scheduled Cold Hard Truth this evening at 7:30. We may be having an 11 o'clock streaming. I don't want to inundate you guys with the live streaming, but we may be having one at 11 o'clock with Woody Foster. We're going to be talking about some things from a business perspective, what's going on within the business community. As you guys know, Woody Foster is the newly elected president of the Cayman Islands Chamber of Commerce. So we're going to try to have a word with him. We do know that some businesses are having to lay people off, hotels are closing, as well as just a lot of businesses are going to have to close. Kirk Freeport is closing some of their stores, and they are actually also going to have to tell staff to take like vacation and sick leave. And we want to get into some of that as well, the implications of some of that. Stanley says, good morning, Ms. Hill. Thank you so much for such important information. Keep up the great work. Ms. Joy says that she's watching. Annette Francis says that Cuba has the vaccine. So let me talk about some of these things that have been in circulation. So someone else sent me a message this morning saying, oh, China has some drug that they were using previously for people who had Ebola disease, and it didn't work for them, but they're now trying it as like an experimental thing on people with coronavirus, and it's working. There are rumors about Cuba having a vaccine or having something that helps. There are all sorts of rumors that are floating around. And we know that Germany is obviously trying to work in a vaccination, but you don't just have a vaccine overnight, first of all. And they don't have an existing vaccine, or they probably wouldn't have any cases of the coronavirus. And we do know that Cuba now has several cases of coronavirus as well. So there's no confirmation of anyone currently having a vaccine that we know to work and that has been tested. Now, in certain countries, like the United States of America, for example, and Cayman as well, you're not going to be able to put a vaccine in the general population and just inject people with something without it having gone through some sort of clinical trial process. That's simply not how it works, because we could be injecting ourselves with only God knows what that could be making us worse or killing us or having side effects that are far worse than the coronavirus. So, even if Cuba had something, there's still protocols that other countries have that any vaccine would have to go through. And listen, there's good reason for this, because there are people in our community who are anti-vaccination, who go around spreading all kind of rumors about vaccines. Oh, they're going to cause your children to have autism. Vaccines or have mercury in them. Vaccines are this, vaccines are that. So countries have an obligation to protect their citizens, not just from things like the coronavirus, but also from things like people who want to make money off of, oh, we've got a cure, we've got a vaccination, and they're just going to push anything out there. And then next thing you know, we're in a worse situation worldwide than where we started. So there is no confirmed vaccination. There are people who we know are working very, very hard around the, I'm just going to look this up real quick. They're working very, very hard around the world trying to come up with a vaccine. And as we all know, a vaccine is not a cure. It is really something that is trying to offer some immunity, some protections towards things like this. So CNN reported 2 hours ago. So again, we want to try to get our information updated, that a clinical trial has started as of yesterday by the National Institute of Allergy and Infectious Diseases. And the first patient has received the clinical trial for a vaccine that they're trying. So it says there's currently no vaccine for coronavirus, but there's a clinical trial for something that they're thinking may be a potential vaccine. Of course, again, they have to make sure that a vaccine is safe and induces a desired response from the patient's immune system. And you have to understand what vaccines are and how vaccines work. Proven that the vaccine is effective in preventing COVID-19. So again, you can't just be injecting people with a vaccine and thinking, oh, it may not even work, or it may work, whatever. There's certain criteria that are required for a vaccine to be accepted. So it has to be safe and it has to be effective at actually preventing infection of the novel coronavirus, which again is now considered an urgent public health priority, and it's a pandemic worldwide. So this is phase 1. First patient received it yesterday. She was a female patient. The trial is being funded by some organization here that is run by Kaiser Permanente, I think is how they pronounce their name, but they're Healthcare Research Institute in Seattle, Washington. And as you guys know, in the United States of America, the Seattle area is the area that kind of had like a major outbreak and the most deaths and stuff so far in the US. So this vaccine uses genetic material called messenger RNA, which was developed by these scientists in collaboration with a biotech company. And so we will see how that works. People have 6 weeks to sign up for the trial. It's a phase 1 trial, and then they'll see from there. And some of these scientists have previously experimented with a MERS vaccine targeting a protein on the virus's surface, which gave them a head start for developing a vaccine candidate to protect against COVID-19. So again, because, these medical experts are out there doing research on other diseases that might have similar genetic makeup and composition to COVID-19, they already have a little bit of a head start probably on trying to find a potential vaccine. So we've got some Instagram questions here. They shouldn't force them to take sick leave or vacation. We're going to definitely talk about that probably this evening show. We've been going now for almost an hour and a half, so we're not going to go too much longer here. Should close and still pay them, maybe give them sick for 3 weeks. What are they going to do? Where are they going to find the money? So yeah, those are some serious concerns, and we're definitely going to talk about those in this evening show. There's just so much involved in this that I wanted to do a morning segment to kind of, get the discussion out there. So in terms of Cayman, so again, our borders are shutting down. So if you have, as I rub my eye here, but I assure you, I've been like obsessive with hand washing. If I go out of my house, like I don't come back in, I don't touch my toddler, I don't touch anything. I head straight and like wash my hands. I'm not a believer in hand sanitizers for health concern reasons, but that's just me. I think hand washing is definitely the most effective way to go. So Cayman Airways is adjusting their operations for airport closures. We put that article up last night. If you've not seen it yet and what that means in terms of you changing any reservations or making any travel plans, please do so, because basically the airport is going to be shutting down for 3 weeks, and then it's going to be reevaluated where we're at in that 3-week period and kind of where we're going to go from there. So we heard the rumors about the airport shutdown from Saturday afternoon after we put up a post about all of the flights that were coming in, because CNN actually featured us on their news, and more than one person sent us a snippet of that. And it's kind of interesting, but basically a lot of private planes are coming in. Rich people have access to a lot of stuff. And so they've been taking advantage of that, taking advantage of the fact that we have very few cases here. And they have been flying in under the radar. I understand that Dwayne Wade and Gabrielle Union are actually here, like they flew in a couple of days ago, but now they all need to make plans to fly out. So here's what's going to happen. Premier Alden McLaughlin announced yesterday, Owen Roberts International Airport, Charles Kirkconnell Airport, which is the Cayman Brac, will be closed for international flights for passengers from Sunday, March the 22nd at 11:59 p.m. until April the 12th. So no more international travels from Sunday, March the 22nd until April. So all persons arriving into the Cayman Islands are now required to isolate for 14 days. It says all persons. So that does mean Caymanians, visitors won't be coming in unless they're planning on staying for a very long time. So even if you have kids who are coming overseas, encourage them to self-isolate, because that's what's going to be required here. And I guess, it's hard to enforce that except to tell people self-isolate, stay home, don't come out. Someone said to me yesterday that someone who works in Health City was out grocery shopping, and they were saying to them, "Oh yeah, I'm supposed to be self-isolating, but I don't have any I don't have anyone to go grocery shopping for me." And I was just like, "Huh? Say what?" Okay. I don't know how accurate that is. I'm only telling you what someone has said to me because I found that to be extremely bizarre. But yeah, you need to find someone to help you. Of course, then if you potentially have it, the person helping you is thinking, well, I'm exposing myself to this person who's supposed to be self-quarantined. There are services that do grocery shopping for you, allow you to go grocery shopping. So maybe look into some of those options as well. We have a friend who went overseas, and he was in Miami for like a week, and he's recently returned. We're not taking any chances. Sorry, you can't come to our house during the next 14-day period. We have a child that we have to be concerned about. We have to be concerned about ourselves. And this person needed to drop off something for me, leave it outside, spray it down with some Lysol, wait 5-6 hours later. Then I go pick it up with gloves, leave it somewhere else. So if it has any viruses on it, it'll die. The viruses will die. And then I can take out the package in the next couple of days. So again, the sister islands, this is really, really important because a lot of people are now thinking, oh, I'm going to go to the BRAC. I've got some time off of work. I'm working remotely. So I'm going to go and relax and take it easy and whatever. No. The BRAC has a significant population of elderly individuals. And there's someone actually who was messaging me yesterday about the BRAC nursing home because they have some concerns about what's going on there. I've not yet had an opportunity to listen to that message, but I will today. They're trying to protect the sister island population, which is so much smaller, right? So there will be no flights to and from the BRAC and Little Cayman. They're going to be restricted to residents only. So only if you're a BRAC resident, critical workers, and officials. So if you do not live in the BRAC, if you are a Caymanian, but you live in Grand Cayman, you will not be going to the BRAC. You will not be going to Little Cayman. Stay put, folks. Do not expose, because Cayman BRAC has a disproportionately larger number of elderly people. So this could be so much more catastrophic for them. So do not expose those persons to potentially this virus, but trying to go over there and have a vacation now that you've got some flex time from work. Don't do it. The airport is going to remain open for emergency situations. So if there's like a medevac patient, cargo flights will continue to come in and out of the Cayman Islands as well. There's no evidence that, cargo packages are carrying the disease. There's no evidence that, food is carrying it or anything like that. So again, these are public health and safety decisions that have been made. So you've got until Thursday, basically, to get it together and to have your plans to be able to go out of this country as quickly as possible. So let me just wrap up this segment now. And again, like I said, we'll continue the conversation this evening because we have been going for an hour and a half now. I do want you all to also be aware of the fact that most of the hotels on the island are shutting down. So far, we first heard about the Marriott early yesterday morning. So they were supposed to call us back at 2:00, but they never did. But by that point, we knew that they were closing anyway. So the Marriott is closing. The Ritz is closing to some extent. The Kimpton Seafire, the Westin, Little Cayman Beach Resort, Cayman BRAC Beach Resort, Cobalt Coast Resort. And I think the Marriott finally posted something on their social media pages, which we'll share here shortly, but they're definitely closed. I think someone said the Ritz might keep like one restaurant open or something. And they may be offering like one meal a day to staff or something like that, the staff that will be remaining. So a lot of people have questions about if they're here on a work permit, what do they do? What are their options? Where are they going, sort of thing. So we're going to talk about some of that into the afternoon, and into the evening show. And we do have some additional We do have some additional questions that we're going to try to address with Mr. Woody Foster from the business and employment side of things when he comes in. So we do know that some employers, such as the Cayman Islands government, is paying staff early. So I think by Wednesday of this week, you guys are supposed to have early pay. Now, please be sensible with your money. Yes, you're getting paid early, but they haven't said they're giving you any extra money. So you're just getting paid early, but you got to make sure that money stretches, right? So be sensible about that, please. CNB actually on Friday gave their staff an extra $1,000. Hats off to CNB, so that they could go shopping and they could go stock up on some groceries and stuff like that. So this now is where you really get to see what companies are made of here in the Cayman Islands. They're companies who have benefited from Caymanian labor, from being a business in the Cayman Islands forever, and they have never contributed anything back to the community, even in hard times like this. Oh, we don't have the money, there's nothing that we can do, blah, blah, blah. And so it's a little crazy. That's all I can tell you. So Charlene said there's a clip circulating stating not to take this vaccine because it's even more dangerous than the COVID-19 itself, and it will kill you. If there are any concrete or confirmed cases, read this. So I'm assuming Charlene's talking about the Cuban one. I hope I clarified that in terms of there is no vaccine right now. There are some clinical trials that are starting, but that's it for now. So by this evening show, I'll see what I can find out supposedly about this Cuban thing. Listen, the danger of this information, and the government is talking about, they're going to arrest people for fake information and false rumors and whatever. The thing that you need to do, and that's what we're trying to do here in Cayman Mall Road in all seriousness, is try to do the research for you guys and provide you with the correct information. Threatening people and saying, we're going to just lock you up for spreading false information isn't really going to get you that much further ahead. Let's just be honest. People gravitate to information because they want information, first of all. They want some good news. They're hoping that when they see something like this about there being a potential vaccination, they're hoping that that's true. And people just want to believe stuff too. So the way to address, in my opinion, these types of rumors is to get the accurate information and to put the correct information out there. Not to threaten people like, we're going to lock you up for spreading false rumors. Okay, someone sent out a voice note last week that said their teacher at SciFec was infected. That was incorrect. But what good is locking her up going to do? That, just put the correct information out there. People have a way of thinking about governments who try to suppress information, whether it's true or not, whether the information is true or not, the way that you respond to it. So getting your panties all in a bunch about, this is fake information, we're going to start locking people up. That sounds like China. That's the kind of thing that China does. What most modern societies do is you simply talk to your people, which now they're doing. Now they're going to have daily press conferences during the week. You talk to your people, you educate your people, and you build a rapport with them so that, they're able to trust you. That's what this is about. If the populace, if your people trusted the government, these false rumors tend to not be able to pick up the legs and run that they do. So we're going to go ahead and end our live stream now. Somebody on Instagram says, thank you for waking up early and doing this segment, Miss Sandra. Much appreciated. Stay safe. So people from the Cayman Islands cannot travel to the sister islands. That's correct. Not if you don't live in the sister islands. So someone said, you're serious? Wow. That stuff was even on a commercial and the news in the US, the rich and famous flying in on private planes. Absolutely. My workplace is closed, but we're still working from home. That's in Jamaica. Yep. So a lot of people are offering flex hours. And again, we can talk about that a little bit later on. Someone said, for real, thanks, 100%. We need to know what the government is going to do about people who work in tourism and are going to do for work, and how we're going to pay bills without no more cruise ships for 60 weeks. Not 60 weeks, honey. 60 days. So that's the good news. It's not 60 weeks. Wow, we would be in a lot of trouble. 60 days. Yes, not weeks, right? We enjoyed our break, bro. Thanks, Sandy. Okay. All right. So I'm going to go ahead and end the show now. Thank you guys so much for tuning in. Like I said, there's a possibility that we will have an 11 o'clock segment. When government goes live, they're supposed to be doing a press conference again at 2 o'clock. When they go live today, we will be live streaming that on Facebook. And we'll do what we did yesterday on Instagram so that you guys who only have Instagram can watch it as well. So basically, we're just holding it up to the screen so that you can see it. And so we'll do that. And then we've got our regular show this evening at 7 o'clock. So make sure you guys tune in for that. And we'll continue the conversation from this morning. So we'll talk about some of the questions that you guys have here. If you work in tourism, some of the labor and employment related topics, and we'll continue to go from there. So thank you guys so much for tuning in this morning. I really appreciate the love and support. We're here trying to get as much correct information out as possible because I think that's very, very important. Again, we wish to extend an invitation to Mr. Shamari Scott from Health City, if he wants to come on and sort of tell us a little bit more about what transpired there, because I do think a lot of people have questions about that. All right, folks. So have a good day, and just, keep an eye on when we go live so that you guys can tune in and continue to find out what's going on in your communities.
You don't know who I know all about you. I've come to talk to you tonight about the things I've seen you do. I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold or the truth. You don't know who I know all about you. I know all about you. I've come to talk to you tonight. I've come to talk to you about the things I've seen you do. About the things I've seen. I've come to set the record straight. I've come to set the record. I've come to shine the light on you. I've come to shine the light on you. Let me introduce myself. Let me introduce myself. I am the cold or the true. I am the cold or the true. You don't know who but I know all about you. I know all about you. I've come to talk to you tonight about the things I've seen. I've come to set the record straight. I've come to shine the light on. Let me introduce myself.